Hi, everybody. Welcome to this session. Today, we're going to look at Sustainable Development Goal number 3, which looks at reinvesting in health, making sure that health is available for all at all ages. My name is Eunice Ndirangu. I'm the Dean School of Nursing and Midwifery at the Aga Khan University and also the Chair of Nursing Council in Kenya. So to start us off, I'm going to give you a little story about my background, and we'll see how that story evolves to what we do in terms of ensuring that we maintain the Sustainable Development Goal number 3. So I was born in a little town, in a small town called Nakuru, which is in the Rift Valley in Kenya. When I was about 5 years old, my father took me to a career event. And during that career event, as I was in nursery school, I dressed as a nurse. Now, I have no idea why I chose to dress as a nurse that day. I don't know, happenstance perhaps, a coincidence. But what I do remember is that a year earlier I had had my first bout of malaria. And during then I'd been admitted to a hospital, and this amazing nurse had taken care of me. Many years later, I've not forgotten of that incident. So this event really summarizes how I, as Eunice, have managed to get opportunities to get to where I am today. You might wonder, what has this got to do with Sustainable Development Goal number 3? Just bear with me for a minute. I started school at the age of 4, and I was able to remain in school through high school and through to graduate level of education. I had an equal chance to education as my brothers did. I had good access to care. Remember my bout of malaria? I was able to have access to care and get well. In addition to that, I had all my childhood immunizations. I got a good nutrition, and my mother was able to have me in a health facility under the care of a trained healthcare worker. So the sustainable development photo you see here is a photo taken in my daughter's school. And I was very amazed at the fact that we are starting at a very young age to get individuals to think about what sustainable development goals mean. So what is sustainable development goal number 3? This focuses on ensuring that healthy lives and we are able to promote health and well-being for all ages across their lifespan. It is about universal health coverage. It is about not leaving everybody behind. So what does health for all really mean? I can tell you what it does not mean. It does not necessarily mean more hospitals or more equipment. It does not necessarily mean more buildings. It means that every little girl, every little boy gets an equal chance to get access to good quality, affordable healthcare. It means a focus on resources where it matters most and where there is most impact. I do not in any way claim to have all the answers on how we can make health for all a reality. The truth is, health is all complicated. To some, it's insurmountable, and others think a health for all is not a feasible concept. Nonetheless, I'll focus on what I know and what I have a passion for, and that's nursing. And I'll try to explore how, in a small way, nursing can help attain SDG number 3. Now, allow me to paint a picture for you. The photo you see here illustrates a situation during a cholera outbreak in Kenya. So, if I may say so, this picture speaks 1,000 words about the reality of the health situation in this country. So, cholera is a communicable disease that is preventable. So, if by doing simple health promotion activities, the people you see in this ward here, many more, need not be in the hospital at that time or even today. So the focus should be really on how do we keep people out of the hospital and how do we make sure that they are able to get available education and guidance and perhaps activities that will help them promote their health. When I was 5 years old, looking back and going back there, healthcare was free. Today, you have to pay for healthcare, even within public facilities. As if that is not enough, some individuals have to trek long distances to be able to access a health facility that has the relevant resources and provides the specialist care that they may be seeking. When they get to the facility, they're likely to find that they may not be having some drugs, and perhaps in some instances, there aren't adequate healthcare providers. Allow me to illustrate this. In Kenya, for every 10,000 members of the population, we only have 11.7 nurses. In Tanzania, 5.8 nurses for every 10,000 population, and Uganda, about 12.4 nurses for every 10,000 population. Let me put this in context for you. In the US, you have 145.5 nurses for every 10,000 people. That's just how the situation really is. So when we look at Kenya in particular, over 85% of the trained health professionals are actually nurses. And we find that often nurses are the first and often the only point of contact when it comes to provision of healthcare among the population. So I dare say, I think we need to think about how to maximize on this particular cadre of health professionals if we are to think about Sustainable Development Goal number 3. Now, how do we look at nursing as a universal profession? We do know that nurses focus on promoting health, they prevent illness, they restore health, and they alleviate suffering. They are trained as a cadre based on their own nursing philosophy to ensure that the holistic care is provided to each patient that they come across. So, how do we make the impossible possible? Allow me to digress a little. The art of climbing a palm tree or a coconut tree for that matter is one that leaves me in awe. The tree is not wide enough to have both feet step on the back of the tree. Neither are there touch points for which the climber can touch when they're going up the tree. But over the years, men have mastered the art of climbing that tree and positioning themselves to get to the top of the tree to harvest some coconuts. Look at how they do it. It is nothing sophisticated, no machinery, just a simple rope. And in some instances, if you've seen the men climb the coconut tree, they just do it using their feet and their hands. Well, I'm not suggesting that the answer to attaining health for all lies in or is contained in a rope or in climbing an actual coconut tree, but I am actually proposing solutions in wearing a different lens. We need to look at healthcare from a very different perspective. We need to think about how do we ensure that we are creative enough using the available resources we have, using the health challenges that we face to think differently about healthcare. Allow me to use the COVID-19 pandemic as an example. When the pandemic struck, we received certain guidelines. Wash your hands, wear your mask, keep social distancing. Trust me, all of us were in a panic, thinking about how will the African continent manage this with limited resources. But there's something that this showed us: innovation. We saw instances where people were able to create water points using reusable materials, using pedals that they could step on to reduce the need for electricity or automation that would have been pretty expensive. We saw also nurses stepping up. Home-based care and isolation came to be a big deal for us. And this being led by nurses then contributed greatly to keeping people out of the hospital and at the same time ensuring that indeed we are having people access care. But there's something else COVID-19 has done for us. It reminded us the central role of nursing profession in the healthcare system. This is quite ironic considering the fact that 2020 was the year of the nurse and midwife. Nothing like a pandemic to hammer the message home for all of us and to remind us clearly of this fact. So let's just say that in the end, we need to think about how we take care of this cadre of nurses, who then often, due to the fact that they are remunerated lesser, sometimes don't always have access to equal opportunities to education, and often not the ones in leadership position. How do we get them to that position? How do we get ourselves to elevate the image of the nurse? If I go back to my own story, I remember graduating with a PhD, and someone asked me, "Are you still a nurse, or did you stop being a nurse and become something else?" Yes, I am still a nurse. And yes, nursing and nurses can develop in a lot of ways. So what are we doing as Aga Khan University School of Nursing and Midwifery in order to help ourselves or to contribute to universal health coverage, in order to contribute to the Sustainable Development Goals, and in particular goal number 3? Since its inception in 2001 in the region, the university has graduated over 2,600 nurses and conducted thousands and thousands of short courses. We have had the privilege to train even more nurses through ensuring that continuously we are able to engage with various entities in the public sector to provide much needed training. The university focuses on ensuring quality education that is of an international standard in a developing country such as the one I come from. This is in keeping with the words of His Highness the Aga Khan, and I quote, "I believe deeply that if developing countries are to be successful in their aim of becoming modern economies with living standards comparable to the West, we must focus not only on universal access to education for the majority or even all of the population, we must make available educational opportunities at the top international standard for exceptional students who stand out from the rest." End of quote. AKU is focusing its programs in educating nurses and midwives to look at health using a very different lens. We teach them to think critically, to innovate, to be creative, to solve the problems that they face on a daily basis. Towards this end, we've been able to start an inaugural Masters of Science in Advanced Nursing Practice and Advanced Practice Midwifery, which is the first of its kind. And this really wears the lens of public health and ensuring that primary health care is a focus if we are to attain universal health coverage. We at AKU are also leading the way in enhancing and raising the standards and the image of the nurse in the country. Through the funding of Johnson & Johnson and our key partners such as KFW, we've been able to empower nurses by ensuring that through their associations, they're starting to be able to tell their story and they're able to demonstrate that which they can do in their workplaces. But there's been one interesting side effect for us, and that has been the intergenerational mobility. When we talk about sustainable development goals and we look at all the sustainable development goals around gender equity, around raising the economic standards of individuals, what educating a nurse has done is to enable these graduates get better income, also in turn elevate their own families, but also take their own children to school. And remember, the majority of our students are actually female. So what's the call to action? I have to say we need to place nursing at the center at all healthcare levels. Nurses are able to ensure that an interprofessional healthcare team works seamlessly. The State of the World's Nursing Report 2020 by the WHO recommends policy interventions that enable nurses to maximize impact and effectiveness in their education, skills, and jobs. Such investments would contribute largely to sustainable development goals. So we need to provide opportunities for nurses to be leaders. We also need to provide opportunities for nurses in the policy formulation table. A rethink in nursing education is also critical because the question we need to ask ourselves is, what does the education contain and how does it prepare the nurse and midwife to work effectively in a complex, diverse setting? Bear with me for a minute as I give you an example. The mean age in Kenya today is 19 years old. So the question we should be asking ourselves is, can we train our nurse to think about what they need to do with that 19-year-old to help them access health today, but also to promote their health tomorrow? Looking at the increasing numbers of non-communicable diseases in the country, I would imagine we should be allowing our nurses to think about health promotion for this particular population so that in the future, it will reduce the strain on critical care units and other specialized care that is needed, like whether it's renal care and so on. As indicated earlier, the Sustainable Development Goals are interlinked. And because they are, we need to keep thinking about health, not from a disease perspective and a prevention perspective, but also how other aspects come into play, like climate change, food security, and how these affect healthcare and health promotion across all ages. Innovation is something else we need to think about in the call to action. Waiting for solutions to come from elsewhere is often not costly and sometimes not a viable option. Think about the man who was climbing the palm tree. What is our rope? What is our local solution? I think enabling nurses and placing them in tertiary primary healthcare is a solution, is our rope. Creating a health network at the grassroots with which the nurse can link between the community and the health facility is another rope we can hold on to promote health. Focusing funding on growing and nurturing locally responsive innovation is another rope we can hold on. Stories are told of water tanks that have been built by donors, and when they break down, the communities are left without safe drinking water as they await for the next donor to come knocking. Yet, a water reservoir made from locally available materials would have been perhaps cheaper and also easily replaceable. We have seen people grow vegetables in sacks as they live in their buildings if where there is no land. The options are unlimited. In the end, we need to make the possible possible within the local realities. In conclusion, health for all requires access to affordable quality care where and when it is needed. It is about investing where it matters the most. It is about recognizing those at the heart of providing and promoting healthcare and working closely with them in terms of a multidisciplinary team in making this a reality. In the words of Virginia Henderson, the nurse is temporarily the consciousness of the unconscious, the love of the suicidal, the leg of the amputee, the eyes of the newly blind, a means of locomotion for the newborn, knowledge and confidence for the young mother, a voice for those too weak to speak, and so on. Thank you very much.